She earned her degree in Doctor of Medicine at the UERM Ramon Magsaysay Memorial Medical Center, where she also finished her training in adult psychiatry. She pursued her subspecialty training in child psychiatry at UP Philippine General Hospital. Currently, she holds the position of Secretary of the Philippine Board of Child and Adolescent Psychiatry, and she holds her clinic in Quezon City. Her years of practice as psychiatrist and raising two wonderful teens turned her professional and personal journey into advocacy, helping parents understand their children by giving lectures in schools and forums. She will walk us through the challenges in parenting children with special needs and why they are vulnerable to difficulties during this time of pandemic. And she will share advice on how we can help parents help themselves and take care of their children. So we are all in for a night of learning and interactive discussions. Doctors, teachers, parents, advocates, guests. It's an absolute honor to bring to this online stage Dr. Maria Celina Tizon Germar.
Hello, good evening. Can you hear me now? All
We
right.
can hear you, ma'am.
Okay. So, good evening, everyone, and welcome to this webinar. Thank you. Wait, okay. Wait, I have to click here. Sorry. Here. I think that's all right. Okay. So, again, good evening, everyone, and welcome to this webinar. Thank you, Elham, for such a lovely introduction. I would like to thank Dr. Concepcion and the PSCAP board for this invitation to talk on a topic close to my heart, being a mom too of a child with special needs. So let us begin. COVID-19 is beyond anything we imagined. Oh, sorry. Can't hear me? I'm sorry. I can you hear me now?
We can hear you, ma'am.
Because I just saw that.
Yes,
Okay. Sorry. Okay. So, COVID 19 is beyond anything we imagined. 11 months into it, parents are still grappling with the extraordinary changes it has brought to our families. Children with special needs, as well as parents and caregivers, make up one group that is going through a difficult time and facing an additional burden of understanding and dealing with the challenges brought about by the pandemic. Under the present circumstances created by COVID 19, the structure, routine, and special services for kids with special needs were severely disrupted. Parents experienced stress from the new demands that were placed on them, including meeting all their child's special or additional needs without support, a break, or respite, often alongside working and meeting the needs of others in the family. Around the world, about 15% of the population live with disabilities, and this is more prevalent in low and middle income countries. In the Philippines, based on 2018 UNICEF data, about 5.1 million Filipino children are living with disabilities. When we discuss a child with special needs, we are referring to a person who's 18 years old and below. Special needs refer to the special or unique, out of the ordinary concerns created by a person's medical, physical, mental, or developmental condition or disability. Additional services are usually needed in the areas of thinking, communication, movement, getting along with others, and taking care of self. So this webinar will discuss the challenges faced by a parent caregiver of a child with special needs during COVID 19. Strategies for managing these challenges will be discussed, and we will also address the importance of self care for parents. So, what are the challenges in parenting a child with special needs during COVID 19? Parent2 et al. Identified 7 challenges. So, the first challenge for families was how to explain to their children with special needs the following: what COVID 19 is, the necessary safety precautions involving hygiene, wearing of face masks, as well as social distancing measures. This challenge is mostly due to difficulties with receptive and expressive language skills. Another challenge is facing transitions, especially adjusting to the stay at home lifestyle and transitioning from routines that were previously in place to a different set of routines. For those children who were in school and were receiving interventions, the shift to staying at home all day was difficult. Transitions and changes in routine were disruptive and led to severe behavior problems. Children's social skills were affected. Restrictions due to COVID 19 has led to loss of opportunities to interact in person with others and has also led to loss of opportunity of participating in organized social activities. Prior to the lockdown, most children with special needs already reported higher levels of loneliness and a lack of peer support compared to typically developing children. Their loneliness may be further exacerbated as they miss their classmates, teachers, and therapists. In most cases, learning has become a challenge. Children with special needs lost access to school and academic programs, as well as physical, occupational, speech, and behavioral therapies. Fears about children missing learning opportunities surfaced. Parents had to face balancing work demands with supervising e learning and therapies. Concerns about regression, loss of academic, social, and other critical skills also developed. Structure was affected. The loss of predictability was very disorienting for children with special needs. Disruptions in their schedule and changes in their physical environments proved to be challenging for children who are rigid, rule ridden, and boundary driven. School being done at home and mom or dad becoming teachers became confusing for these children. Um, Children's responses to the pandemic are unique and varied. For some, pacing, stimming, hand flapping, crying, or excessive self talk became frequent. Some had difficulty with self care, sleeping, and eating. Regressions also occurred as children with special needs had to adjust to a new routine or sense anxiety around them. For others, aggressive behavior increased. Some children became irritable or clingy. Some became worried and inattentive. Others also became unmotivated, sad, and withdrawn. So, given all these challenges, parents need to develop effective strategies in parenting a child with special needs during COVID 19. Jung et al. From the University of North Carolina identified 7 strategies. These 7 strategies include supporting understanding, offering opportunities for expression, prioritizing coping and calming skills, maintaining routines, building new routines, fostering connections, even from a distance, and being aware of changing behaviors. So let us discuss these strategies one by one. To support understanding, parents need to explain the virus and the situation, such as lockdown and social distancing, in simple, direct, and concrete language. Information must be provided through various formats. They need to be child friendly, could be audio only, large print, easy read, pictures, and sign language. Visual supports will be helpful in offering guidance on coronavirus specific actions and behaviors. Social stories with the use of modified text, photos, or the use of technology is effective in explaining the situation. The stories may be read regularly across several days, and these stories may be adjusted as needed depending on the situation. As explanations are given, adults should reassure children about their safety and the safety of loved ones and tell them that it is the adult's job to ensure their safety. Addressing children's anxiety will also help support their understanding. In explaining to children with special needs, use short sentences. Speak slowly. Try and state things using first then language. For example, you say first mask, then outside, rather than saying, John, you have to put on your mask first before we can go outside. We also need to use familiar words and relate information to familiar experiences. For example, you could say, remember when you got sick, you stayed in the hospital? Lola is sick now and is in the hospital. So be ready to repeat information regularly as needed to support understanding. Different kinds of visual supports may be given to facilitate understanding. So you could use gestures or demonstrate instructions as you speak. So, for example, you could demonstrate washing hands, staying at least 6 feet away from people, or wearing a mask. If the child can read, you could write down keywords as you speak to support understanding. Show photos as you explain. For example, video of a medical worker in protective gear as you explain what happens when people go to the hospital. Also, provide a visual schedule of the steps that will occur. Use a social story to explain what will happen. For example, use pictures and photos to tell a story of what will happen when the individual goes for a COVID-19 test. Or you may even show a video to explain what is going to happen. So here is an example of a social story about the coronavirus. Notice that it uses simple words, the sentences are short, and uses illustrations to explain what will happen. This may be read again and again to the child to support understanding. Next is an example of a visual schedule for hand washing, showing the steps from beginning to end. And well, I hope this works. Here's a video of how a nose swab test is done, produced by BC Hospital for Children. So let's watch it for a while.
This is Nicole. She's a nurse at BC Children's Hospital, and she's going to show you everything you need to know about how we do a test for COVID-19.
Hi there. First, I always put on protective clothing, like a mask, plastic eye shield, and yellow gown to keep everyone safe from germs. For your test, you might sit on your mom or dad's lap, unless you're a big kid. Then you might sit on a chair or exam table. I'll need to put this small swab into your nose. Can you see how skinny it is? It's specially designed to check for a virus that might be way at the back of your nose. You'll need to hold your chin up so the swab can reach the back of your nose. Mom, dad, or another grown-up might need to help you keep still during your test. You might like to plan what you want to do with your hands. Some kids like to hold a squishy ball or their favorite stuffed animal, or you might like to hold your parents' hands. I'll need to measure from your nose to your ear to know how far the swab needs to go inside. By the time you count slowly to 5, the test should be over. 1, 2, 3, 4, 5. That's it.
Okay, so I hope you you enjoyed watching that. That's a very good way of explaining to children how a nose swab test is done. So this slide shows us a social story about going for an emergency visit to the hospital. This is part of the care kit prepared by the Institute of Mental Health of Singapore. There are a lot of free materials online which you may use or which may serve as a guide as you prepare your own visual supports for your child. So let's move on to the second strategy, which is providing opportunities for expression. Provide various means for family members to express their feelings as they are able. There could be family and individual discussions, writing activities, vlogging, or play. This table gives us examples of various activities that may be introduced to the child depending on their abilities or interests. So if they're interested in art, if they're interested in writing or in making video journals, there's so many things that could be used so that your children would have opportunities for expression. You could also support the use of augmentative and alternative communication. Whether your child's device is high tech, like an iPad, or low tech, using visual pictures, icons, or choice boards, make sure that he has a way to request or share relevant information during this time, as vocabulary needs have now changed. The third strategy involves prioritizing coping and calming skills. I would like to highlight that exercise, physical activity, is a proven strategy to reduce anxiety symptoms. Make it fun for your child. You may learn a dance from YouTube or TikTok. Or you may go on a nature walk while listening to music. Maybe you could do an exercise routine with your child's choice of music. So there are so many options for inside and outside activities, even if there's a pandemic. So we could go if in your area it's okay to take a walk or ride a bike, or maybe do some gardening or yard work. That will really be helpful. Teach coping and calming strategies to your child. Identify the time of day when your child is calm to start teaching. Make a visual routine to support the use of these strategies. And schedule coping calming activities regularly across the day. So you may include massage, music, stretching, playing with a favorite toy as some of the coping or calming skills for your child. Here now are two examples of visual supports that may be used to teach breathing exercises. I particularly like this one in the middle. It's so easy to explain to the child how to take a deep breath by pretending to smell a flower and then asking the child to blow the pinwheel. So it helps in terms of learning what it means to take a deep breath. We also have here a list of apps that are available for calming strategies and guided meditations, such as Calm and Headspace. So we have here both free and paid apps, which your children might find useful, or you might even use them. Okay. So it's also important to create a chill out zone for your kids. Choose a space that is clutter free, quiet, and dim. Put objects that may be used for calming your child. A noise canceling headphone for auditory sensitivity, favorite toys or books, sensory toys, or a weighted blanket may be used. It's important to explain to your child that this is a place he can go to when he needs a break or needs to calm down when he gets upset or frustrated. When he's in a calm frame of mind, have him go into the spot and see how it looks and feels. It is always best to practice using these strategies before a crisis arises. This is not a timeout corner, and it is not to be used for punishing your child. Okay? So the next strategy is maintaining routines. Create a daily schedule built around basic activities like waking up, eating meals, preparing for bed, exercise, free time, bath time, and screen time. You also schedule learning slots throughout the day. Your child's age and special needs will determine the length of time per learning slot. For younger kids, these learning slots might be devoted to reading a book or playing a game together. For older kids, let them have some say in which activity they want to place in any given slot. But also plan for gradual transitions that suit your child's pace. So allow for play, relaxation, or a break. And also get them moving. Schedule a physical activity in the day, but schedule quiet time as well. Plan for a relaxed schedule, allowing for flexibility. Pay attention to what seems to work and what does not. You could always make changes to these routines that you make. Remember to minimize surprises. For example, if you need to leave the house, give everyone advance notice and let them know when you will be back. So the visual schedule shown here is a full day routine, which is a mix of activities. Notice that there are only 2 learning slots and they are followed by enjoyable activities. This is to avoid struggles in transition. Movement is also incorporated several times a day. So you use a visual schedule regularly throughout the day. You may use laminated pictographs, videos of daily routines, or a daily checklist. Depending on the ability of your child, it could be a first then board, or a morning, afternoon, and evening schedule, or a daily schedule as was shown to you in the previous slide. So encourage your child to participate in creating the schedule by taking pictures, selecting pictures from your phone or from Google Images to print out. Here are some apps for creating visual supports and social stories. A few of them are free. Okay. So it's also important to set physical boundaries in providing structure. It is important to set up a specific study area for your child that will help him physically separate school and home. Having a regular place for studying will condition your child that work is expected when he is in that space and that out of it, he is already off from school. If possible, if you have more than one device, label one device for learning and other devices for play, recreation, to help separate work from play. Tackling bedtime is an important routine that must be maintained throughout the week. So, how do we establish routine? Set a schedule, ensure your child goes to sleep and wakes up at the same time each day. Get quiet. Establish a nightly bedtime routine where the lights are dimmed and your child can unwind and relax. Also, get unplugged. Make sure all screens are turned off at least 1 hour before the intended sleep time. Set a ritual. Practice relaxation techniques such as listening to soft music, reading, and meditation. Breathing exercises can also be helpful. Have bedtime stories, massage, hugs, and kisses. Or you may also try weighted blankets on your kids. So it's important to do as your children do. Better still, sleep when they do. This is a routine that will benefit everyone. So the fifth strategy we're going to discuss is about building new routines, such as getting used to safety measures and facing transitions from school time to personal time and in the use of screens. Giving your child choices can empower him. So learning how to use masks can be a challenge for children with special needs due to sensory sensitivity. So demonstrate using the face mask on an object or person, or maybe a stuffed animal, a doll, or a family member. So let your child choose among fabric face masks to find one that is most comfortable. Practice wearing the face mask for short periods and go on short outings so that the child could get a feel of how it works. Use a photo of the child wearing a face mask as a visual cue to wear the mask before outings. Well, aside from ensuring that your child knows how to do proper hand washing, also be aware of possible sensory assaults which may affect their compliance. Frequent use of hand sanitizer, Lysol, bleach, or other cleaning products could be creating discomfort for your child. So let your child have some control over sensory input, such as letting him choose the scent for the hand sanitizer, or let him take the cap off the hand sanitizer and put it back on after you have used it. Having control of some steps help desensitize kids. Teach your child also about social distancing and role play it at home. Emphasize that when they go out and meet others, handshaking, hugging, or kissing are not allowed, and that they need to stand at least 2 arm lengths away from others. Visual supports will again be helpful to teach social distancing to your child. In-home learning is a major challenge that parents and children face currently. So, how do we make this work? First, set realistic expectations. Acknowledge that times are tough. You are not your child's usual teacher, and they are not used to you being their teacher. Be realistic also about your own abilities. If you're still working full or part time, it is okay if less learning gets done at home. Also, you could ask your child's teachers and therapists for guidance. You could meet with them to monitor progress and to get updates. Also, go back to basics. Try setting your priorities for the day and the morning and see what could be done. But also, be flexible with your parenting standards. Accept that there are going to be some days when little can be done. If you can manage to do academic work with your child 3 days a week instead of five, that's all right. So settle for less academics. Learn through play and fun and teach life skills. We should also strive to prioritize the things that children require even more than schooling. So ensure physical and emotional safety. Make sure that there's a responsive adult and that you provide unconditional love and acceptance. Another question that parents would ask would be how to balance parenting and work. So, if you could, speak with your employer. Could you take a medical leave, do flex time, or work from home? You could also use visual aids and timers to let your child know your work hours when you are home. You could have visual stoplights, so door signs that are green to say that you are free, or a door sign that's red when you are not. And also, if your child is doing work in another room, you could check in on them from time to time to let them know that you are there. Again, I'd like to emphasize go easy on yourself. It is okay if your work life is not up to its usual standards. Times are really difficult. Um, we also need to prepare our children for transitions. Use a visual timer to make it clear to your child how much time he has for an activity. Bring the child's attention to it when you set it and keep referring to it throughout the activity. So you could say, look, we have 2 minutes left. You also use picture schedules to help your child know and understand what is coming next. Practice the art of distraction. Singing tends to work wonders for distraction during transitions, and movement activities as well are really very helpful. Have a consistent way of signaling that an activity is over. So you could sing or play a specific song, you could ring a bell, or you could say all done. No? But one important thing that helps with transition is not to rush it. If you know that the child is going to struggle with transition, give him and yourself as well lots of extra time to make the switch from one activity to the other. Now, here's one subject that's also very common among parents, that of managing screen time. So it's important to schedule device-free time and assign device-free zones. For younger children, there should be no devices in the bedroom. For older children, all screens should be off in the bedroom after a set time. All screens should be off 1 hour as a minimum before bedtime. All family members should switch off devices together at dinner time. And here, consistency is key to making this work in managing screen time use. If you find that your child is spending excessive amounts of time on his gadget, reduce screen time gradually. You can do this by planning for screen time in the daily schedule. Using a timer to let your child know how much screen time they have helps them to know what to expect. Also, it's important to plan screen time to follow an activity that they do not prefer to help ease the transition from one activity to the other. Okay, so ensure that Screen time is a mix of active, passive, and educational use. Active use allows your child to interact with the media, so like video chats and gaming. Passive means no active engagement. So this involves watching television, movies, music videos, or YouTube videos. Passive means no active, educational use, um, maybe active or passive, or a mixture of both. But it involves learning which takes place during screen time. So it's important to use media together. It gives you the opportunity to monitor what your older children are seeing online and to follow what they are learning. You also use social media for connection. Check in with your neighbors, friends, and loved ones. In building new routines, offer choices whenever possible to help your child feel in control. Provide 2 to 3 concrete options and utilize visual or textual choice boards or menus if appropriate. Children also often feel more in control when they can play an active role in helping themselves, their families, and their communities. So they can help around the house by doing chores such as feeding their pets, watering flowers, or setting the table. Allow them also to plan or choose what to eat for lunch or dinner. So these are small choices, but these are very helpful in making them feel in control. Share with them ways they can help the community by following safety guidelines, such as covering their cough, keeping their hands away from their face, or washing their hands. So, um, the next one is fostering connections even from a distance. Put effort in facilitating social connections. Children with special needs are more vulnerable to social isolation and loneliness. And social distancing should not mean social isolation. So, how do we foster connections? We encourage them to contact family, teachers, and friends through text or direct messaging. We help them connect with others via online platforms to attend family celebrations, join in gaming, or complete their schoolwork with classmates. They can even have a virtual meal with a friend, and you could let them set up the silverware in front of the screen for his guest. Schedule also visits with family, friends, neighbors, or teachers. These may be done through video conferencing, audio only applications, emails, or even driving by a friend's house for short, socially distant conversations. Having these visits can be really encouraging for your child. So use video chat apps such as FaceTime or WhatsApp, Google Hangout, Marco Polo. There are so many choices that can be used for connecting with other people. Encourage your child to join organized social activities that creates opportunities for friendship for children with intellectual and developmental disabilities. Well, you could check out Best Buddies Philippines on Facebook to know more about their activities, which could be joined through Facebook or through Zoom. They have Wellness Wednesday activities and a Saturday series where the kids take part in crafts and other fun activities. So another strategy is that's important is to be aware of your child's changing behaviors. So be alert for signs of anxiety and depression because they may not be able to verbally express their fear, frustration, and anxiety. You may see changes in their sleep patterns. They may have insomnia or they may oversleep. There may also be changes in eating patterns. They may refuse to eat or overeat. You may see increases in repetitive behaviors and notice excessive worrying and irritability. One of the most challenging behaviors to deal with will be an increase in agitation, where you might see hitting, head banging, biting, or throwing and breaking things. You may also see decreased self care. Emotional and behavioral changes in children are to be expected during a pandemic as everyone adjusts to a new sense of normal. If children show an ongoing pattern of emotional or behavioral concerns that do not resolve with supports, professional help may be needed. Many mental health providers are available for teleconsultation when in-person social contact must be restricted. So what supports can be given for children with anxiety? Remember to restrict your child's consumption of news. If they have questions, be honest, explain clearly, and respond at an appropriate level for their ages. Work with kids to create their own personal strategy plan. So this will involve teaching your kids calming practices like deep breathing, meditation, mindfulness exercises. Give them pleasant alternative activities. You may also keep a gratitude journal in which you and your child could list things for which you are grateful. And you could also talk with your kids about who they could talk to about their concerns, like a therapist, a trusted friend, or a trusted relative. Maintain a calm atmosphere in the home, even if you are stressed. So, maintaining a calm atmosphere in the home, even if you are stressed, can be helpful. Okay. So, for sadness, grief, or anger, what do we do? First, try to ascertain your child's feelings. Check in with your child frequently about how he's feeling and listen without interrupting. Acknowledge your child's emotions and remain supportive. Validate their feelings. For example, if a child says he's scared, rather than telling your child there is no need to feel that way, validate the child's feelings by telling him it's okay to be scared and offer to talk about why he or she is feeling that way. But then, what do we do for challenging behaviors? First, let us identify the different stages of behavior. We have a green proactive phase where a person is mostly calm and relaxed. We have a red reactive phase where the challenging behavior occurs. This is when you notice that the child starts to become anxious. The red reactive phase is where the challenging behavior occurs. And then it's followed by a blue post-reactive phase where the person starts to relax again. How then do we manage these behaviors? Proactive strategies are strategies that are useful during the green proactive and amber active phases. Routine and structure, boundaries, and rewards help keep a child in the green phase. This is when we could effectively teach a child communication and coping skills. When you see a child start getting anxious in the amber phase, look for triggers. Recognize the early warning signs of the behavior and think about how to respond when you see this. Adjust the environment to deal with sensory issues if these are present and help the child calm down. Also, be aware of how you talk to your child. Be firm and calm. If you maintain your calm, the child will most likely calm down too. Okay? So, reactive strategies are designed to keep the person and those around them safe. This is for the red reactive phase when the child is already having a meltdown. Do not respond to the behavior and say less. In a meltdown, kids are cognitively overloaded, and listening to parents' words will only agitate them and make the behavior worse. So try to distract and redirect your child. You use calming devices like a fidget toy, noise canceling headphones, or a weighted vest. Keep yourself calm as your child can feel your frustration and that could worsen the meltdown. Keep your face and voice neutral and be at arm's length in case the child reaches out. Also, prevent injuries to your child or others during a meltdown by being in a safe place. Leave the room or location to help your child calm down. That could be helpful. Then, the question is, how do you stay calm during your child's meltdown? So, breathe and pray. And remember, this too shall pass. Zone out, check out, disengage mentally and emotionally from what is going on. Also, you could give yourself a break. When all else fails and you feel your tension rising too high, take time to reset. Sometimes it is helpful for parents to take a minute away from their kids to reset and take their own time out. Because a few seconds of mental time away from the scene provides space and a mental reminder that the minute that just happened is temporary. So this cognitive reframing could be practiced often. Next, you re-enter the challenging scene once you have calmed down. Enter it with a warm voice. As parents model for their children how to be calm, they are also telling their own brains that they too can calm down. So this approach de-escalates the situation. Then finally, after a meltdown, try to figure out what happened, what led to it. If your child is old enough to have a conversation with, sit down and talk calmly about what happened. Make sure that the child feels safe and do not blame him or her for what happened. Tell the child that it's better to try and prevent it from happening again. So I know this is a challenge, but this really works. Um, Another issue that is important to discuss is what to do if you suspect that your child with special needs has the coronavirus. You could arrange for a virtual visit. This may be a good alternative to an in-person visit. And if testing is needed, check for drive-up testing sites. That would be less stressful for them. But if your child has more urgent symptoms and needs to go to the or to the hospital, be ready with a social story to explain to your child what will happen. That will make it less stressful for your child. But then at the ER, make sure that you give a clear history of your child's symptoms and past medical issues to the doctor. Be clear about the start of symptoms. And then take time to explain how your child communicates, especially for those patients who cannot verbalize pain or discomfort. And you could also share calming approaches that can be used with your child. As parents, we do hope that we do not get sick, but we need to put a plan in place if it has happened. So, what do? We identify who will take care of our child in case we get sick, and we train them. We also create a care plan or manual for our child that will include daily routine, medical issues, list of health and therapy providers. So, this is the link to care plan that you can use. So you prepare also for quarantine or stay at home. You stock up on medications, supplies, or other items that your child uses regularly. And as has been said repeatedly, use a social story to explain to your child what is happening. Now we're on our last part of our webinar. This is about self-care. For parents of children with special needs, burnout is a real risk. Taking care of ourselves often feels like a luxury on a normal day, but during these challenging times, it can seem almost impossible. However, we need to remind ourselves that by taking care of ourselves first, which is hard to do but really important, we will be better able to take care of our family. We need to take care of our body, our mind, and spirit. So, how do we do this? For our body, yes, we need to take care of our diet, eat healthy foods, limit junk food, drink 8 glasses of water. We need to exercise regularly, moderate intensity activity per week, about 150 minutes. It's important to have 8 hours of sleep per night and best between 10 p.m. and 8 a.m. You also need to take breaks several times during a day, just 1, 2, 3 minutes, that's okay. But just take time to breathe and take time for yourself. And well, because of COVID, really need to practice safe hygiene practices, wear a mask, practice social distancing, wash our hands often, disinfect our living areas. How do we take care of our minds? We acknowledge our reactions, allow ourselves time to reflect on what we are feeling and how we may be reacting to any fears and uncertainties about the future. We also connect with families and friends to maintain our support network, even while socially distancing. Let's resist withdrawing and isolating ourselves from the support and caring that others can provide. Ask for help. Do not hesitate to ask for help from friends and family. Pay attention to positive news instead of only focusing on negative and fear producing reports. Limit your access to the news. Just choose what you will listen to. Have some fun. Share relaxed moments with your family when you are not focusing on work or school. So play games with your kids, go for walks, do cooking projects. And then let go of unreasonable expectations. During the pandemic, accept that things may not always go as planned and that you or your child may make mistakes. That is okay. Stay positive. Be kind to yourself and remember that the most important action is to simply make sure that your child feels loved. Also, develop daily habits of praying, performing random acts of kindness, noticing something good about someone and complimenting them, being gentle and forgiving of ourselves and others, and practicing deep breathing, meditation, mindfulness, or yoga. If you are having a hard time, seek support from mental health practitioners. There are hotlines available where you could call for help. We have NCMH Crisis Hotline and Hope Line, among others. Finally, I would like to leave you with this reminder that all that you do be done with love. So, raising a child with special needs has taught me to take one day at a time, to focus on the present. I remind myself to be grateful every day. We live in challenging times, but I've learned to appreciate the gifts of this pandemic and to see that this journey can also be beautiful, fully placing my trust in God's hands. So that ends my lecture. These are my references, and thank you all for listening.
Thank you, Dr. Germar, for that insightful lecture. It was clear, simple, and easy to understand. So while we give Dr. Germar some time to catch her breath and hydrate, we shall proceed to the live quiz. So I will read the questions, and when you hear the word go, you may start typing